Hello my dear friends, welcome back. Now after completing all the muscles of the pectoral region, we have discussed all the muscles in detail with their nerve supply from the brachial plexus and all. Now after discussing that one, we are going to do like all the concepts which are related to the pectoral region only. I mean to say like I am going to take a transverse section here showing you the axilla here, the boundaries and content of that. Then we are going to take a sagittal section. In that we'll actually see the clavipectoral fascia. Then we'll learn about the deltoid muscle, the intermuscular spaces. So that is exactly the planning here. So after completing all the muscles in the front view and back view, now if you learn all these concepts, it becomes easier for you guys. Okay. So now do one thing, just look at the screen here. The image that you are able to see is actually the transverse section in this region. And in this transverse section, you are able to see the axilla here guys. So let's study in detail about the axilla now. First of all, we'll see all the boundaries of axilla guys. So in this diagram, let's see what will be the boundaries of axilla. The moment you see this image guys, the moment you look at this image here, first of all try to understand the orientation of this one, like what is the lateral side, the medial side, the anterior and the posterior one. The one thing which is like very much easier here, I am able to see this bone here which is humerus bone, and the humerus bone is present over there. Definitely that will be the lateral side guys. That is actually the lateral side. Humerus bone will be towards the lateral side. If there is a lateral side, definitely the opposite of that, that is the medial side. You are able to appreciate there the rib there, I mean to say the thoracic wall. Along with that attached, it will be the serratus anterior muscle. And then this one here will be the anterior surface guys. There is the anterior side and this will be the posterior side. Now you might be wondering, sir, how to differentiate between the anterior and the posterior? I'll tell you. Observe the diagram very much carefully here. The posterior wall of the axilla, the posterior boundary of the axilla will be more thicker. It is more muscular. You are having like more muscles over there. Why? Because you have got the scapula bone. And scapula bone, anteriorly there will be actually the subscapularis muscle, and posteriorly you will be having the supraspinatus, infraspinatus. So because of presence of all those muscles over there, that is the reason why, remember, the posterior wall of the axilla will be more thicker, more muscular when compared to the anterior wall. The anterior wall of the axilla will just have the pectoralis major and pectoralis minor. So in this image you can clearly see there the posterior wall is like more thicker, and that is the posterior one. And you are able to even find the scapula over there guys. So this will be the scapula. The scapula, which is also referred to as the shoulder blade. When you see that in the transverse section, it will be just like a thin line over there guys. So that is the posterior surface, that is the anterior surface. Now once you are clear with the lateral and the medial and the anterior and the posterior surface here guys, yes, you got the complete orientation. And now the boundaries of the axilla will become like very much easier. So now in this diagram here, anterior boundary. First of all, let us see the anterior boundary here. This muscle without any doubt will be the pectoralis major muscle. So this will be the pectoralis major muscle, and just beneath that pectoralis major muscle, you are able to identify this one here as your pectoralis minor muscles. So there will be a pectoralis major and there will be a pectoralis minor muscle, and these two together they are actually going to form the anterior boundary or the anterior wall of the axilla. Easy. Now what about the posterior wall guys? Posterior wall, it's also very much easier. Why? Because you have your scapula bone there, and scapula bone will be actually a flat bone. Right in front of the scapula there will be a big muscle, and that muscle will be the subscapularis muscle here. So I am speaking about this muscle here guys, that is subscapularis muscle. Subscapularis muscle, and this is actually going to form the posterior boundary of the axilla. It's going to form the posterior boundary of the axilla. Perfect. Once you are done with the anterior and the posterior, lateral boundary is the easiest one. Why? Because without any doubt we have got your humerus bone over there. The humerus is actually going to form the lateral boundary of the axilla. Now the last and final thing which is left out here is the medial boundary, and on the medial side we are able to see here the thoracic wall. On the medial side you are able to see the thoracic wall, and attached to the thoracic wall here, this muscle will be your serratus anterior muscle guys. This is serratus anterior muscle, and that is actually forming the medial boundary of the axilla. That forms the medial boundary of the axilla. So I hope you are now able to recall nightmare, I mean to say your first year MBBS days of anatomy. At that time we used to just mug up all the boundaries of the axilla in the form of a paragraph and all. So please don't learn in that manner my dear friends. Just look at this picture, look at this diagram, practice this once or twice, all the boundaries will become easy. And you know the worst part, if you just mug up with the help of a paragraph there, what will happen? While studying, it will be looking okay, fine. But just before the exam, when you have to revise the entire subject, not only entire subject, when you have to revise all the subjects, then you will not find enough time to revise all of them. So the best way, follow this method here, sir. All the boundaries are made easy. Now once you are done with the boundaries of the axilla here, now let us learn about the contents of this one here, guys. In the contents, you are actually able to appreciate one sheath here, and this sheath here is known as the axillary sheath. There will be an axillary sheath. Now inside the axillary sheath, you are able to appreciate that there is a vein, an artery, and obviously guys, it will be like which artery? It is your axillary artery here. And which vein here? That is your axillary vein here, guys. So you have got the axillary artery and axillary vein. One thing I want you all to keep in mind here is that vein, axillary vein, will always be towards the medial side of the artery. That's an important relation that you have to remember. The axillary vein is always towards the medial side of the axillary artery, and throughout the entire course it will be towards the medial side only. Now apart from that, you are able to even see the three cords there, guys. There will be a lateral cord, medial cord, and posterior cord of the brachial plexus. And right from the very beginning we have been saying the nomenclature of these three cords is with respect to the axillary artery only. So one of the cord you can see behind the artery, that is the posterior cord. One of the cord that you can see towards the medial side, that is the medial cord of the brachial plexus. And one of the cord you can see towards lateral cord of the brachial plexus, guys. So posterior cord, the medial cord, and the lateral cord, there are three cords of the brachial plexus named with respect to the axillary artery. So better we'll do one thing, all these contents of the axilla, let's draw it separately here, guys. So let's see the contents of axilla. So inside the axilla, first of all, you'll be able to appreciate that there will be a sheath, and this sheath is referred to as your axillary sheath. There will be axillary sheath here. Now inside the axillary sheath, there will be an artery here, guys, and this artery will be the axillary artery, and medial to the axillary artery, you will be able to find the vein, that will be the axillary vein here. Fine. So first of all, let us just write down here, these two will be the axillary artery and axillary vein here, artery and vein. Now with respect to the axillary artery, you will be able to appreciate the three cords of the brachial plexus. And let me draw in the same orientation as our previous diagram that we have seen in the atlas image. So there will be one cord which will be behind the artery, posterior cord. There will be one cord which is behind the axillary artery, that is the posterior cord of the brachial plexus. And then there will be one more cord which is towards the medial side, medial cord. And then there will be one more towards the lateral side, that is the lateral cord, guys. So this is the posterior cord. This one here will be the medial cord, and this one here will be the lateral cord. So there will be a posterior cord, then the medial cord and the lateral cord. There are three cords of the brachial plexus arranged with respect to the axillary artery, guys. That's all. That makes all the contents of the axilla very much easier, guys. Okay. Now let me tell you about one more important MCQ here about the axillary sheath. Now what is this axillary sheath, or from where it is coming, sir, exactly? Like it's an extension of what? That was already asked in your exam. So let me tell you in a very proper manner, conceptual manner. Look here, when we studied our head and neck topic, in the head and neck topic, I taught you in the neck region there will be deep cervical fascia, deep fascia of the neck. And deep fascia of the neck will be further having certain modifications like prevertebral fascia, pretracheal fascia, and then you have carotid sheath, investing layer. There are so many modifications of the deep cervical fascia. Out of all those modifications, one of the modifications is prevertebral fascia, where it is exactly present. So you have got your cervical vertebrae here, cervical vertebrae and those muscles around that. So surrounding that, you will be having the prevertebral fascia, surrounding the cervical vertebrae and the muscles. Now try to apply the concept here, guys. Cervical vertebrae, inside that you will be having the spinal cord. Okay, and the spinal cord from C5 to T1, from there originates your brachial plexus. Oh, it means that inside this spine we have got spinal cord, and from there C5 to T1 brachial plexus is coming out. Now how will the brachial plexus come out of that fascia, the prevertebral fascia? How will it come out? Is it going to like pierce through the fascia and come out, or is it going to carry the fascia or extend the fascia forward? So out of these two, remember, yes, the brachial plexus is going to actually carry that fascia, extend that fascia. It's not going to pierce and come out. It's not just tearing that fascia and coming out, sir. It is going to carry that fascia along with that one. So try to apply this entire thing over here. So you have got the prevertebral fascia, it's going to carry or extend. The brachial plexus is going to extend that fascia into the axilla here. So that is nothing but the axillary sheath. Question that was asked in the exam, axillary sheath is actually the extension of which fascia here? So remember, my dear doctors, what is this axillary sheath here? It is extension of prevertebral fascia. It is the extension of prevertebral fascias. Awesome. So that's how we have to actually correlate the head and neck part with the upper limb volar part, sir. So prevertebral fascia will actually extend as axillary sheath. So that completes everything regarding the axilla, the boundaries as well as the contents of the axilla in the easiest manner possible, guys. Crystal clear concept. Done. Now after learning the axilla here in the transverse section, guys, in the same pectoral region, let us now take the sagittal section. Okay. So after learning the transverse section, now let us take the sagittal section. This is how it looks like. So I am cutting it in this manner. Now in this diagram, first of all, what is the muscle present in the front here? Pectoralis major muscle, guys. I hope you all are able to appreciate here. This will be the pectoralis major muscle here. And just beneath that pectoralis major muscle, you are able to find the pectoralis minor muscle here, guys. Okay. And now appreciate that there is a bone here, that is your clavicle, collarbone. Now don't get confused here, guys. We are not seeing the clavicle bone from the front here. So just look at my pen here. For example, you imagine this is our clavicle or collarbone. So we are not looking at this clavicle from the front. You are not able to see the entire clavicle. We are actually taking a sagittal section, and after cutting it like this here, I am going to turn it like this here, guys. So once you turn, you are able to see only this much part of the clavicle here, so only this part of the clavicle. So that is actually what you are able to see there. And just below the clavicle, there will be a small muscle there, and that muscle will be your subclavius muscle, guys. The name itself is telling you subclavius muscle. So just beneath the clavicle, just below the clavicle, you are able to appreciate that there is a subclavius muscle. Now all this will be actually enclosed in a fascia. So if you are able to appreciate here in this diagram, yes, first of all, look here, the subclavius muscle is enclosed by a fascia here. This one will be the clavipectoral fascia, beginning from the clavicle, clavi, and it is going to move forward and then split and enclose the pectoralis minor muscle, and further it is going to continue down into the axilla as suspensory ligament of the axilla, guys. So this is basically, this is the one which I am speaking about here. It is going to continue below as suspensory ligament of the axilla. So that's your clavipectoral fascia. Fine. So better we'll do one thing here. Let's draw our diagram here, guys. Clavipectoral fascia. Let's discuss about the clavipectoral fascia right now. So imagine this one here to be your clavicle bone, which we are actually seeing in the sagittal section. Attached to this one here will be the pectoralis major muscle first, and then beneath that pectoralis major muscle, you are able to find the pectoralis minor, and just below the clavicle there is a subclavius muscle, guys. Let's write down the names here. This one is pectoralis major muscle. This muscle here will be the pectoralis minor muscle, and this one below the clavicle here will be subclavius muscle, guys. There are three muscles over here. Then from the clavicle, beginning from the clavicle, there will be a fascia, and this fascia moves down and then splits and encloses the pectoralis minor muscle here, and then further it is going to move down. That's your clavipectoral fascia. And just first of all, write down one thing here. This clavipectoral fascia is going to continue down into the axilla as suspensory ligament of axilla. Suspensory ligament of axilla. That's one important thing here, guys. Now apart from that, what else is the important thing to be learned here? Remember, clavipectoral fascia is the one through which three structures are going to pierce through that one, and that has been asked a lot of time in your exams. So first of all, there will be a vein, that is your cephalic vein, which I even showed you in the deltopectoral groove here. So cephalic vein is going to pierce the fascia. Number two, there will be an artery here, and that artery will be thoracoacromial artery, thoracoacromial trunk, whatever you love to say. And then there will be a nerve here, and obviously that has to be pectoral nerve, because we are in this region only, pectoral nerve. But which one? Is it the medial or the lateral one? Remember, it is a lateral pectoral nerve. So these are the three structures which are going to pierce through clavipectoral fascia. So structures piercing the clavipectoral fascia. Number one will be the cephalic vein. Number one, cephalic vein. And number two, there will be artery, thoracoacromial artery or thoracoacromial trunk. And number three will be the lateral pectoral nerve. Lateral pectoral nerve. So these three structures are going to pierce through the clavipectoral fascia, and this is like utmost important for your exams, guys. Has been asked a lot of times in almost every exam. Okay, and this completes the sagittal section in this region here, guys. So, according to my planning, what I am trying to do here is, in the pectoral region, after knowing about all the muscles, I have told you about the transverse section in which we studied about axilla, and the sagittal section in which we have actually studied about the clavipectoral fascia. After this, let's move towards the next topic here. The next topic that we are going to discuss here, guys, the nerves related to humerus. Extremely important topic for your exams. Remember, there are totally like 3 nerves which are related to humerus. Number 1, we have got the axillary nerve. Number 2, there will be a radial nerve. And number 3, there will be ulnar nerve. So, we have to remember these 3 nerves which are directly related to the humerus bone and how they are related and where they are related exactly. Is it okay? And all this is like very clear in this diagram. But before showing you in this diagram, let us do one thing here. Let's draw our diagram and then we'll come back and cross check with the atlas diagram here, sir. So, please write down the heading there as nerves related to humerus. Nerves related to humerus. Now, in total, how many nerves are related to humerus, guys? There are totally like 3 nerves related to humerus. Number 1 will be the axillary nerve, and number 2 will be the radial nerve, and number 3 will be the ulnar nerve, guys. So, these 3 nerves are related to humerus bone. Now, to understand that perfectly how they are related and everything, we need to draw the diagram of humerus. So, let's draw a neat beautiful diagram of humerus here, sir. In the upper end of the humerus, you will be able to find the head of the humerus on the medial side, and then there will be a greater tubercle towards the lateral side, sir. So, head of the humerus will be always towards the medial side, and of course, it has to be towards the medial side. It is the one which is involving the shoulder joint. But whereas the greater tubercle will be present more towards the lateral side. So, this will be the greater tubercle here. And lesser tubercle of the humerus will be present more anteriorly, sir. So, this one is lesser tubercle. So, I repeat again once more, guys. Head of the humerus will be towards the medial side. Greater tubercle will be towards the lateral side. And lesser tubercle will be present in the front anteriorly. Now, right in between the lesser tubercle and the greater tubercle, you will be able to appreciate one depression here, and this is actually known as the intertubercular sulcus. Intertubercular sulcus. Look at the beautiful name which is given, guys, very much meaningful. Inter, in between, and in between the 2 tubercles, greater and lesser. Intertubercular sulcus, it's a depression there. But recall one very important thing that I said you. For example, if this one here will be the glenoid cavity of the scapula. I am not drawing the entire scapula there, just try to understand glenoid cavity. Try to recall, which I already taught you. Suppose if this is the glenoid cavity, above the glenoid cavity there will be one tubercle here and below there will be one tubercle here. Supraglenoid tubercle, infraglenoid tubercle. There will be a supraglenoid and infraglenoid tubercle. And from both the tubercles, long heads will originate. From the supraglenoid tubercle, long head of biceps will originate. And from the infraglenoid tubercle, long head of triceps will originate from there, guys. Okay. So, therefore, if you just imagine this one here to be your supraglenoid tubercle, and from here we can see the long head of biceps passing from here only. So, long head of the biceps is actually going to pass from where only? Intertubercular sulcus. That's the reason why it is also referred to as bicipital groove. Bicipital groove, guys. Why? Because biceps tendon is passing from there only. So, bicipital groove. Now, apart from thing that you have to know here is about the neck. There will be like 2 necks here. One is anatomical neck, another one is surgical neck. So, let us just try to understand where do we have exactly those 2 necks here. So, now in this diagram, you will be able to find one neck over here between the head and the 2 tubercles, guys, and this is referred to as the anatomical neck. So, this is nothing but the anatomical neck. And how can you identify the anatomical neck, sir? It is between the head of the humerus and the tubercles, the greater and lesser tubercle, guys. So, between the head on one side and the tubercles on the other side, it will be anatomical neck. And there will be like one more neck over here, and this will be the surgical neck, guys. This is the surgical neck of humerus. Then how can you identify the surgical neck of the humerus? Remember, the surgical neck of the humerus is between the upper end of the humerus, complete upper end, and the shaft of the humerus, sir. So, the surgical neck is between the complete upper end of the humerus and shaft of the humerus. So, it is between the complete upper end and the shaft of the humerus. And now, welcome back to our topic, guys. Don't forget our topic. What is our topic right now? The nerves, the three nerves which are related to humerus. Out of that, number one will be the axillary nerve. And axillary nerve is the one which is going to pass behind the surgical neck of the humerus. So finally, my dear doctors, what is the final concept that you have to remember here? It's only two things. Your focus should be only on two things: name of the nerve and the location. So what is the name of the nerve here? Axillary nerve. And it is going to pass from where? Behind the surgical neck of the humerus. Then the next one is a radial nerve, and the radial nerve, every medical student knows that it is the one which is going to pass behind the shaft of humerus. And behind the shaft of the humerus, there will be a groove here. That groove is known as the spiral groove. Okay. So this will be the radial nerve here. And radial nerve, remember, it is going to pass through the spiral groove here. And in some of the books, it is also referred to as a radial groove, guys. So you can remember spiral groove or the radial groove. And the last and the final one, the third nerve, that is your ulnar nerve. And ulnar nerve, remember my dear friends, it is the one going to pass behind the medial epicondyle. So this will be your ulnar nerve, and that is passing behind the medial epicondyle. Medial epicondyle. Fine. So let me just summarize here, my dear friends. Finally, at the end, you just have to remember like 3 points here. I told you, right? Name of the nerve and its location. So axillary nerve is passing behind the surgical neck of the humerus. Radial nerve is going to pass in the spiral groove. That is also like behind the shaft of the humerus. And ulnar nerve is the one which is going to pass behind the medial epicondyle. And that's all, guys. These are the three nerves related to your humerus. Now, because this concept is very much important, I don't want to take any risk here. Let us complete like 2 more points here, sir. So, one more thing here is that along with the axillary nerve, there will be one artery passing, guys. There will be one artery which is going to pass along with the axillary nerve. Now, if you people are telling okay, it is axillary artery only, then you are making a big blunder, guys. Listen here carefully. Suppose if this is the surgical neck of the humerus, there will be an artery going around that one. Now try to remember, in anatomy, whenever any artery is going around, the name of the artery will be circumflex artery. If any artery is going around, then it is circumflex artery. Now it is going around the humerus, circumflex humeral artery. What is the name of that? Circumflex humeral artery. And one will be anterior circumflex humeral artery, another one is the posterior circumflex humeral artery. And now, my dear friends, from that time I have been telling you that axillary nerve is going behind the surgical neck. So that is the reason why we can easily make out what is the name of this artery here. This artery will be nothing but your posterior circumflex humeral artery. It has to be posterior one, posterior circumflex humeral artery going along with the axillary nerve. Now there is one artery which is going along with the radial nerve also, guys. There is an artery which is going along with the radial nerve. Now what is the name of this artery? I'll tell you the trick how to remember that. Listen to me. This is our arm. Arm is also known as brachium. Now in the brachium, you will be actually having one artery here which is known as the brachial artery. And that brachial artery is giving a branch, and that branch is going deep inside and then going along with the radial nerve. Now in anatomy, the word deep, the meaning of that is profundus. Profundus means deep. Okay, so that is the reason why the name of this branch is profunda brachii artery. Profunda brachii artery. It's the one which is going along with the radial nerve. So along with the radial nerve, you'll be having profunda brachii artery. Profunda brachii artery is the one which is going along with the radial nerve, guys. Awesome. And this one picture here, one diagram here, there are so many MCQs which are possible here, guys. So please take care about that one. So that completes all the three nerves related to humerus. Now let us just go back to that atlas diagram here. If you just look at this diagram here, guys. Now in this diagram, I think you will be able to appreciate here, number one, that there is an axillary nerve over here. An axillary nerve is the one you can clearly see there. It is going to pass behind the surgical neck of the humerus. Behind the surgical neck of the humerus, guys. Number two, you are able to appreciate in the diagram here, that's your radial nerve here. And radial nerve is the one which is going to pass in the radial groove or else the spiral groove, just behind the shaft of the humerus. And finally, in this diagram, you are able to appreciate ulnar nerve over here. And ulnar nerve is the one which is going to pass behind the medial epicondyle of humerus. Awesome. So that is the exact diagram that we have drawn there. So therefore, the things will become easier right now, guys. Let's move to the next topic here. Now in the next topic, the moment you look at this diagram, I hope all of you are able to appreciate that it is actually the back view. We are looking at this pectoral region from a from behind, guys. And I know my students are like expert in this diagram. They all know all the muscles present over here, guys. So above the spine, you are able to see the supraspinatus. Below the spine, you are able to see the infraspinatus muscle there. But I am not interested in that one right now. I am actually interested about the remaining muscles present in this diagram. The lateral border of the scapula, you can clearly appreciate that this muscle here will be the teres minor muscle above. That's your teres minor muscle. Let me just zoom in for you people. And just below the teres minor, you are able to appreciate here, this will be the teres major muscle here. And then guys, this one has to be the long head of triceps, definitely. So in the back view, you are able to see the triceps muscle only. So that is the long head of the triceps. And without any doubt, what is this bone here, sir? This is the humerus bone. Now just try to understand the way how they are actually arranged, guys, the way they are arranged. So I hope you will be able to recall your MBBS days. We used to make a mnemonic, okay. So take two fingers here like this horizontal. The one which is above will be the teres minor here, and the one which is below will be the teres major. So you can remember, it is easy to remember, guys. Most of the students will be even getting confused. Okay, sir, upar wala, the above one, is it minor, or the niche wala, the below one, is it minor? It's very simple. Below you are able to see your middle finger, your favorite one, the bigger one, teres major, and above it is teres minor here. So teres minor, teres major. Then take two another fingers here, long head of triceps, and this is the humerus here. Now just overlap like this here, guys. So this is the teres minor here, teres major, and this is the long head of triceps and humerus. Just overlap. And once you overlap like this here, you are able to see here a space form, quadrangular space, and below there will be one more space form, lower triangular space, and there is one more space form above here, that is your upper triangular space, guys. So basically I am slowly moving towards the topic of intermuscular spaces, the spaces present in between the muscles. So you are able to appreciate here that there is a quadrangular space here, and then there will be a small space present below, that is lower triangular space there, and then one more small space present above here, that is the upper triangular space, guys. So these are the three intermuscular spaces that you have to learn, and better let's draw the diagram here together. So let us learn about the intermuscular spaces with the help of a small diagram here, guys. So imagine this one here to be the glenoid cavity of the scapula, and then if this is the glenoid cavity, definitely there will be head of the humerus here, and then on the lateral side will be actually having the greater tubercle there. So that's your humerus bone there, guys. So the scapula and the humerus. Now from the lateral border of the scapula, you will be able to find a teres minor muscle above. And we all know very well, teres minor muscle will actually go and get inserted where, guys? It will be inserted onto the greater tubercle. I hope you remember that rotator cuff, sits muscle, in that SIT, supraspinatus, infraspinatus, and teres minor will also be inserted onto the greater tubercle. Then just below that, you will be able to find teres major muscle, and that will be actually inserted onto the humerus bone only. So what is the muscle that is present above here, guys? Above you will be able to find the teres minor here, and the one which is below here will be the teres major here. Fine, teres minor, teres major. Now once you are done with these two muscles here, the next one will be the long head of triceps. And I told you already, the long head of biceps and triceps are actually originating from the glenoid tubercle, and from infraglenoid tubercle will be the long head of triceps here. So this will be the long head of triceps here. Hope there is no confusion at all. So this will be the long head of triceps here. Now once you are done with all these muscles over here, guys, you can clearly appreciate the three spaces which are formed between them. So you are able to appreciate here, this will be the quadrangular space here, guys, and this below here will be the lower triangular space. The one which is below here will be the lower triangular space, and the one which is above here will be the upper triangular space. And once you draw a diagram here like this, you don't even have to worry about the boundaries. Don't even write down the boundaries. You can just imagine this picture in your mind, and you yourself can write down the boundaries, guys. I'll tell you, for example, if you just look at that quadrangular space, rectangle shape, what is present above that? Superior boundary. The superior boundary is nothing but made up of teres minor only. And what is present below that? Inferior boundary of the quadrangular space, that is teres major. And then medially you are able to see the long head of triceps and laterally humerus, guys. So boundaries you don't have to mug up at all. You can just look at the picture and answer. Now the most important thing is, what are the contents? What is passing through that one? So let's deal with that one by one. So this space here is actually the quadrangular space. That is a quadrangular space. Now what is the content of quadrangular space? What is going to pass from here? That's the reason why just I have done the previous topic, nerves related to humerus. Come on, recall. In the nerves related to humerus, we have learned that there will be a nerve which will be actually taking a turn around the surgical neck of the humerus. That is axillary nerve. And along the axillary nerve, what is that artery present, guys? Posterior circumflex humeral artery. So these two structures are passing through the quadrangular space. It makes sense now. So therefore, number 1, axillary nerve, and number 2, the posterior circumflex humeral artery. There will be axillary nerve and the posterior circumflex humeral artery. These two structures are passing through the quadrangular space. They are the content of quadrangular space, guys. Next one. The space present below here, will be the lower triangular space. Lower triangular space. Now, what are the structures which are going to pass through the lower triangular space? What is the content of that one, guys? So, in this lower triangular space, we will be able to see one nerve passing from here. That's your radial nerve. And along with radial nerve, what is that artery, guys? The artery present along with that will be the profunda brachii artery. So, lower triangular space will allow the radial nerve as well as the profunda brachii artery to pass. Profunda brachii artery. So, these two structures are passing through the lower triangular space. Now, the last and final one which is left out here will be the upper triangular space, guys. So, this is upper triangular space. Now, what is passing through the upper triangular space? We did not discuss this till now, guys. Let us discuss here. There will be one artery actually. There will be an artery here and that artery will be taking a turn like this around that lateral border of the scapula. It's taking a turn. And I said to you, in anatomy, whenever any artery is going to take a turn, the name of that artery will be the circumflex. And it is going to turn around the scapula. That is why the name of the artery will be circumflex scapular artery. Circumflex scapular artery. And that is going to pass through upper triangular space. So, what is the content of upper triangular space, guys? Circumflex scapular artery. Circumflex scapular artery will be the content of upper triangular space. That's all. So, in one diagram, we have concised all the 3 triangles, I mean to say all the 3 intermuscular spaces, and what is the content of that, and boundaries are automatically made easy, guys. So, this is the best way to learn about the intermuscular spaces. That's all. We'll move towards the next topic now. Now, guys, moving towards the next topic that we are going to learn is about the deltoid muscle. I am going to cover every concept in this region as I said you. Now, next is deltoid muscle. In anatomy, whenever you are learning about any muscle, always the muscles has to be studied under 4 headings. Number 1, origin. Number 2, insertion. Number 3 will be the nerve supply, and number 4, action. Now, first of all, I'll tell you about this deltoid muscle over here. Then afterwards, we'll actually go back to this diagram and then I'll show you guys. First point, deltoid muscle is actually a multipinnate muscle. When we are saying that it is multipinnate, that means it is having like 3 fibers. There will be anterior fibers of deltoid, and then there will be posterior fibers of deltoid, and then you will be having the lateral fibers of deltoid. There will be anterior fibers, there will be posterior fibers, and then there will be lateral fibers of deltoids. Now, from where are they going to originate? Learn in this manner. First of all, what is this bone present behind here? You will be having scapula, and scapula is actually having 2 surfaces. One is anterior surface, another one is posterior surface. On the posterior surface of the scapula, there will be spine, the spine of the scapula. Now, we all know that the spine of the scapula posteriorly will continue here into the acromion process on the lateral side. I repeat again, the spine of the scapula will continue as the acromion process here. And that acromion process will come in the front here. It is going to form a joint with your collarbone, the clavicle, acromioclavicular joint, sir. Acromioclavicular joint. Understanding your point here? So, you have to have these 3 things in continuation here. The spine of the scapula posteriorly, acromion process laterally, and that is going to join with the clavicle anteriorly. Now, just try to connect these 2 concepts together. Come on. The anterior fibers of deltoid will originate from where? Obviously, clavicle. The posterior fibers of deltoid will originate from where? Obviously, the spine of the scapula. And then finally, the lateral fibers of the deltoid, they are going to originate from where? Obviously, the acromion process, guys. And all these 3 fibers will combine together and they will be getting inserted here on the humerus bone. And that too, there will be a tuberosity, and that tuberosity itself is known as the deltoid tuberosity. So, that makes the origin and insertion damn easy, guys. Okay. Now, let's see in this atlas image here. Okay. Now in this diagram, first of all, you're able to appreciate these are the anterior fibers of deltoid originating from the clavicle. Then I'm turning a little bit like this here. Then you'll be able to see the lateral fibers of deltoid originating from the acromion process here. And then I'm turning completely behind. Once you turn completely behind, the posterior fibers. And the posterior fibers of deltoid will be originating from spine of the scapula, guys. Perfect. And you can clearly see in the picture in the middle here, guys. Yes, whether the fibers are anterior fibers or the lateral fibers or the posterior fibers, all of them are inserting onto a U-shaped tuberosity that is known as deltoid tuberosity on the humerus. So origin perfectly done, insertion done, nerve supply, my students are like expert. If you are following all my videos from the very beginning in the sequence in upper limb topic, guys, you are like expert in the nerve supply to deltoid. It is supplied by axillary nerve. It will be supplied by axillary nerve, guys. So let us write down all the notes here. Deltoid muscle. The first point to learn in the deltoid muscle is that it is a multi-pinnate muscle. It's a multi-pinnate muscle. And in any muscle, you got to learn about the origin. Number 2, the insertion. Number 3, the nerve supply. And then finally, the action. The origin, insertion, nerve supply and action. Deltoid muscle will be totally divided into 3 fibers, sir. One will be the anterior fibers of deltoid. And then we have got the lateral fibers of deltoid. Acha guys, try to recall the lateral fibers of deltoid are originating from acromion process. That is the reason why some authors refer to this as acromial fibers. And then finally, you will be having the posterior fibers of deltoids. Posterior fibers of deltoid. Now, out of this, the anterior fibers of deltoid will be originating from where? These will be originating from the clavicle. The lateral fibers of deltoid, from the name itself we can understand, they will be originating from the acromion process. And finally, the posterior fibers of deltoid, these posterior fibers are going to begin from where? They are going to originate from the spine of scapula. From the spine of scapula, guys. Done. When it comes to the insertion, remember all of them has got the common insertion. So all this will combine together, will get inserted onto the deltoid tuberosity. Deltoid tuberosity of humerus, of course. It is located onto the shaft of humerus on the lateral surface. What is the nerve supplying to deltoid, guys? The nerve supply to deltoid will be axillary nerve. Now once you are done with this one, next thing actually is about the action. What is the action of this deltoid muscle? And action, again, I am going to do the same thing here. First, let's apply on our body, then afterwards we'll write down here. And I want you all also to do along with me, guys. Okay, now the anterior fibers of deltoid. If these anterior fibers of deltoid are contracting, my arm will move like this here. That's flexion. Okay, I repeat again, anterior fibers of deltoid will contract and that will lead to what? Flexion. Actually, not only flexion, it will also help in medial rotation also. Similarly, the posterior fibers of deltoid behind, when they contract, my arm will lead to what? Extension along with the lateral rotation. So therefore, I repeat again for the last time, guys, anterior fibers will contract, flexion along with the medial rotation. Posterior fibers of deltoid, when they contract, extension along with the lateral rotation. And the last and final one which is remaining here, the lateral fibers of deltoid, when this will contract, automatically my arm will move like this, and that is abduction. Understanding? So let us just write down here. The anterior fibers of deltoid will actually help in flexion and medial rotation. Flexion and medial rotation of arm. The posterior fibers of deltoid will actually help in extension and lateral rotation. Extension and lateral rotation of arm. And finally, what about the lateral fibers? Lateral fibers are the one which are actually helping in abduction, guys. Abduction of arm. Perfectly done. Now you might be like, sir, why is this topic so much important? Is there any importance? Is there any question asked here? Of course. And the question was mainly about the lateral fibers of deltoid, that is acromial fibers of deltoids. And acromial fibers are actually helping in abduction of arm. And when I am trying to do the abduction of arm, I can start from 0 degrees here. Okay, from the 0 degrees, I can keep on doing the abduction of arm, okay, up to 90 degrees. And not only 90, I can keep on doing the abduction up to 180 degrees also. I can abduct my arm from 0 to 180 degrees here, guys. But is that entire abduction done only by the deltoid muscle? Absolutely no. That entire abduction is not done only by the deltoid muscle here, guys. Okay, then how? So remember, my dear friends, deltoid muscle, lateral fibers, they will be doing the abduction only and only from 15 degrees to 90 degrees only. That's extremely important. The lateral fibers of deltoid are helping in abduction from 15 to 90 degrees only, guys. Now automatically the question mark in our mind, then which muscle is doing from 0 to 15 degrees, 15 to 90 degrees and above 90 degrees. Okay, so there continues with our next concept here. Write down the heading as abduction of arm. Abduction of arm. Arm can be abducted from 0 to 15 degrees and then 15 degrees to 90 degrees and then above 90 degrees. Now I'll tell you first of all in a very practical manner here, guys. Let's apply that on our body and then afterwards we'll write down. No mugging business in my classes over here. Let's everything try to make it like more conceptual. Come on. So first of all, what is this bone again here? Scapula. There will be spine of the scapula. Above that there will be supraspinatus muscle. When this supraspinatus muscle is going to contract, my arm is going to move 0 to 15. When supraspinatus muscle will contract, my arm is going to move 0 to 15. And then the next responsibility is taken by deltoid. When deltoid muscle will contract, my arm will move from 15 to 90. 15 to 90. And after that, I have to move my entire upper limb above 90 degrees. Now, above 90 degrees cannot be done by these small muscles here, guys. Supraspinatus muscle and deltoid muscle, they cannot do that. They cannot take the entire upper limb above 90 degrees here like this. So, therefore, we need a bigger muscle and that one will be actually trapezius muscle here. And that will be actually held by serratus anterior muscle. So, trapezius along with the serratus anterior, both of them will be helping in taking the arm above 90 degrees. So, 0 to 15 degrees abduction is done by supraspinatus muscle. 15 to 90 degrees it is done by deltoid muscle, guys. And if you want to be more specific, the lateral fibers of deltoid. 15 to 90 degrees is done by lateral fibers of deltoid. And then above 90 degrees, it will be actually done by trapezius muscle along with serratus anterior muscle. So, trapezius and serratus anterior muscle. Done. Now, once you are comfortable with this one, now the next thing is, let me discuss like two MCQs here. In one of the exam, what they have done is, they did not give the angle like above 90 degrees. Instead of giving the angle, there was a word given, overhead abduction, like which muscles will be helping in overhead abduction of the arm. So, remember above 90 degrees is nothing but overhead only. You know? So, overhead abduction is done by trapezius and serratus anterior. If they don't give you the angles in the exam, don't get confused there. Overhead abduction, taking the arm above, okay, now, a person is unable to comb his hair. So, all these kind of words will be used. So, in that it is nothing but speaking about overhead abduction above 90 degrees. One more question that was asked in the exam, the shape of the muscle. You might be thinking like silly question, shape of trapezius muscle. Shape of trapezius muscle. Most of the students have that picture in their mind, trapezius muscle, rhomboid. It's like a rhomboid and they have answered that one in the exam. But believe me, my dear friends, that rhomboid is actually the shape of two trapezius muscle together, two trapezius muscle. And in the exam, they are just asking what is the shape of trapezius. So, it is just triangle in shape, triangular, not rhomboid shape. So, remember trapezius muscle will be triangle shaped muscle, that is your trapezius muscle, guys. Fine. And that completes this concept here. Now moving towards the next topic, guys. The next topic is rotator cuff. Rotator cuff, it is actually also known as the musculotendinous cuff. Rotator cuff, it is also known as the musculotendinous cuff. And I hope every student remembers that rotator cuff or musculotendinous cuff, it is actually made up of totally 4 muscles. And there is a very famous mnemonic for that one, that is SITS, sits muscle. First of all, look at this back view, guys. In the back view, above the spine of the scapula, this is the spine here. So, above the spine of the scapula, you are able to appreciate one muscle, and this muscle is nothing but the supraspinatus muscle. And you can see that it is going and getting inserted where, guys? The supraspinatus muscle is getting inserted onto the greater tubercle here. Okay. Below the spine of the scapula, you are able to see one more muscle, and that one more muscle is infraspinatus muscle. And that is going and again getting inserted where only? Greater tubercle. And then Along the lateral border of the scapula, you will be having teres minor and major, and this one here will be the teres minor muscle, and that is also going and getting inserted onto the greater tubercle here, guys. So therefore, out of that sits SIT, that is the one which is inserting onto the greater tubercle. Supraspinatus, infraspinatus and teres minor. Now, after looking at the back view, let us see the front view in front of the scapula. In front of the scapula, you are actually having a big muscle here, and this muscle is subscapularis muscle. And you can clearly see in our picture here that subscapularis muscle will go and get inserted onto the lesser tubercle. There is only one muscle inserting onto the lesser tubercle. Remaining all 6 muscles are getting inserted onto the greater tubercle towards the lateral side. Is it okay? So out of that 4 6 muscle, guys, SIT, supraspinatus, infraspinatus and teres minor will be inserted onto the greater tubercle, and subscapularis muscle will be inserted onto the lesser tubercle. Fine. And do one thing here, after learning this in this atlas image here, better try to apply on our body. So therefore, what is happening here, the subscapularis, anterior surface of the scapula, try to understand, subscapularis muscle inserting on lesser tubercle, supraspinatus inserting onto the greater tubercle, infraspinatus greater tubercle, teres minor greater tubercle. That means all that 4 muscles along with their 4 tendons, musculotendinous, all that 4 muscle along with that 4 tendons, they are going to form a beautiful cuff here, and inside that cuff your humerus bone can be rotated very comfortably and very safely there, okay. And that is the reason why the name of that is rotator cuff, or else it is also known as the musculotendinous cuff, rotator cuff or musculotendinous cuff. Fine. After the entire concept is done, hope you have understood the concept, guys. What I want to do here is that from today onwards, what you do is, don't follow this mnemonic as sits. We'll do a slight modification in this one. Observe here, guys. In that SITS, what you do here is that from now onwards, it's your like S, I and T, you write it in a small letter, and then hyphen and then one more S here, sir. Sits. A slight modification in the mnemonic. I'll tell you why. It will help you a lot. Out of this SITS here, guys, number 1 S here, the name of the muscle is supraspinatus. Supraspinatus muscle here. And then I stands here for infraspinatus muscle here. Infraspinatus muscle. And then T here. Now, what was happening in the exam when the question is asked, most of the students are actually confused whether it is teres minor or teres major. Teres minor or teres major. So, I want my students to write it like, small t, so that it will be definitely present in your mind. It is definitely teres minor, not major. So, try to, these little things will make it easier, guys. So, teres minor muscle. So, supraspinatus, infraspinatus and the teres minor muscle. Perfect. Now, why did I write these 3 muscles together? Why? Because all these 3 muscles are getting inserted. Yes. Where is the insertion of these 3 muscles, guys? On the greater tubercle of humerus. Greater tubercle of humerus. Wow. So, the mnemonic makes sense right now. And then the next one will be the S here, separate one that we have written here. And that S stands for subscapularis muscle, the 4th muscle which is actually contributing for the formation of rotator cuff, subscapularis muscle. And this subscapularis muscle we have written it separately. Why? Because that's the only one muscle which will be inserted onto the lesser tubercle of humerus. Fine. I hope now you are completely understanding like what is the meaning of writing it in this manner here, sir. SITS, sits muscle. So, these are the 4 muscles which are going to form rotator cuff. 3 of them are inserting onto the greater tubercle, subscapularis separately inserting on the lesser tubercle. Perfectly done. One more. One last and final MCQ here. Out of the 4 muscles of rotator cuff, one of the muscle is referred to as the forgotten muscle, forgotten tendon, and that one will be the subscapularis one, guys. So, remember subscapularis muscle, it's also known as the forgotten muscle of rotator cuff. Already has been asked many times in your exams. And again you can remember that is the one which we have written is separately. So, that is your forgotten muscle, guys. So, one mnemonic and everything you can see on the screen there. Let them ask any question in the rotator cuff, we are ready for that one. In one mnemonic, everything is done in a simplest manner, guys. So, that is all about this. And by this, my dear friends, I hope you are understanding my planning. In this region, that is pectoral region, first after learning about the muscles in the front view and the back view, then we have completed all the concepts related to this region. We have learned about the axilla, Then after that the clavipectoral fascia. Then we learn about the nerves related to humerus, followed by the intermuscular spaces, deltoid muscle, followed by the abduction of arm, and finally about the rotator cuff over here. So I think that is the best way, instead of learning all these topics randomly here and there, this is the best way to learn, guys. So that's all about this. Thank you. Done.